My name is Grace van der Poel. I'm a consultant nurse in diabetes and I've specialised for 20 years.
I've got an appointment at 10 o'clock this morning at the retinal specialist.
Diabetes is a condition whereby the pancreas gland produces insulin to keep the balance between the blood glucose levels. If this pancreas gland stops producing insulin or it doesn't produce enough, then the blood glucose levels rise. Well, we all potentially are at risk of diabetes. It usually affects people who have got first-degree relative with diabetes, or if they're overweight, or if they've had a heart problem, heart disease, or if they come from various different ethnic backgrounds, there seems to be a higher risk of having diabetes. The signs and symptoms of diabetes are first, passing a lot of urine at night, also blurred vision, and also people can sometimes have various types of infections that reoccur. So with all these symptoms clustered together, it's a sign that the body is actually not able to balance its glucose levels.
Come in, Carl.
Anybody who experiences these symptoms should really go along to their doctor. It can be easily diagnosed. Some people will have a urine test, which is the first indication, where we take a sample of urine and put a dipstick in it, and it can actually show whether there's glucose in that urine or not. And that will then be followed up with a blood test, a simple blood test from the arm, which can be sent off to the laboratory and will come back with a diagnosis. Once you've been diagnosed with diabetes, the next step would be is to get as much support and information around the condition, because it's a lifelong condition, and therefore people will need to actually have regular annual checkups to make sure that their diabetes is under control and that it's not affecting some of the internal organs as well. If it's, say, for instance, type 1 diabetes, then there will be a lot of education about how to manage the condition with insulin injections and their diet and physical activity. If it's type 2 diabetes, it would be more around the diet, physical activity, and there are a range of oral medications, tablets really, that people could have. What you have to be aware of is that you have to really take on the term we call self-management by actually watching what you eat, having a healthy diet, which is low in fat, sugar and salt, and high in fibre, as well as taking physical activity, and that could be just walking for 30 minutes a day, as well as ensuring that they have regular foot checks and eye checks as well. And the doctor or nurse will be able to advise you how frequent these checks should be. As part of the self-management plan, people with diabetes will be encouraged to check their blood glucose levels at times recommended by their healthcare professional in order to identify at what points in the day their blood glucose levels are rising and falling. So that in a way gives patients a safety net so they can understand what is happening to their diabetes, how different foods affect their blood glucose levels, and how the exercise that they're required to do adjusts their blood glucose levels as well. With modern technology these days, it's not so scary, and therefore they learn very quickly, and it's very easy for them to do. If I found myself in a situation where I became very thirsty, tired, passing a lot of urine, the first port of call really is either your pharmacist or your GP or practice nurse, and explain exactly how you're feeling, and with that explanation during the consultation, the nurse or the healthcare professional would be able to actually give you some idea, some indication as to what to do next, whether it's possibly diabetes. This is the next step, around blood tests and urine tests, and then to formally give you that diagnosis. It's the investment today which is going to actually delay some of the long-term complications such as eye disease, kidney disease and heart disease later on. So the better people are controlled, there is a reduced risk of getting those complications, although we cannot say that they will never get them. So at the time of diagnosis, we do give people information as they need it, but build on it each time so that they actually can connect, all the factors around managing and living with diabetes.
For more information, visit www.nhs.uk.